Hi, my name is Dr. Verity Johnson and I'm a board-certified physician specializing in aesthetics here at Reflections. I specialize in non-surgical aesthetic procedures such as Botox and a wide range of fillers, biostimulators, so including Sculptra and Radiesse, radiofrequency microneedling, Fraxel, CO2 Fraxel, tattoo removal, laser hair removal, skin tightening procedures such as soft wave and Ulthera and Thermage. Oftentimes, the best treatment for you is a combination of several treatments, usually spaced out over a period of time. So during the consultation, when I'm getting to know you, doing the physical exam, that's when we will discuss which treatment modalities are best for you. During the consultation, we discuss your concerns, I'll do a physical exam, and it's a very low pressure environment. There's never any pressure to do any of these treatments. These are all elective at the end of the day. So these are things that you can decide you want to do. They're things you can decide to do in stages, so maybe not all at once. It's really up to you. So after the physical exam, then together we come up with a treatment plan, and obviously it's something that has to work for your schedule. So if you're working all the time, you don't want to have a week of downtime. Maybe you just don't have that luxury to take a week off work. Like many people, we work together to figure out, okay, in light of your work schedule, your life schedule, what are treatments that could help address your concerns and also fit into your lifestyle. We're lucky here at Reflections, we have so many treatments and so many technologies that not everything is right for every person. In fact, more often than not, given your skin type and your lifestyle and amount of downtime you can take off, that really helps us narrow down the treatments that are ideal for you and that will help you achieve your desired outcome. So there's a lot that goes on behind the scenes when we're doing any of these procedures. Even something as simple as Botox, you've got to really understand the muscles, the nerves, the locations, the depths. There's a lot of training that goes on to understand how to get the right outcome. And also patient's anatomy differs, so understanding why you're injecting a millimeter away from another spot can have big ramifications onto how the overall result, how patients look at the end. So I've been really lucky to train with some of the best doctors in America, world-renowned doctors in America, and I've been able to learn a few techniques and tricks and tips from each of them to combine and formulate my own way of injecting and performing different treatments to get great outcomes. When you look better, you just feel better. And it's nice to see people who leave the office happier and with a higher sense of self-confidence than when they came into the office.